The Delta State Contributory Health Commission has trained primary healthcare workers across the Delta North Senatorial District on how best to adapt to the Commission's new policy framework. The training, which held at the Commission's headquarters in Asaba, is coming on the heels of recent technological advancements developed by the Commission to ensure speedy and more efficient service delivery to the enrollees of the state health insurance scheme. Speaking with journalists after the training, the Director General and Chief Executive Officer of the Commission, Dr. Isaac Apoveta, said beyond increasing the number of enrollees into the state health insurance scheme, the Commission was putting sustainable measures in place to improve the quality of care and enrollee satisfaction at the primary healthcare level. Dr. Apoveta said the comprehensive training program on the new policy framework introduced earlier this year is part of a broader strategy to empower frontline healthcare staff, reinforce accountability and ethical standards.
At the moment, we are driving, in the beginning we've been driving enrollment, and we've gotten to 2.6 plus million. But now we are concerned with the services being received by these enrollees at the hospital side. And so the policy this time around is more of the quality of care that the enrollees are receiving at the facilities. Initially, we drafted our service quality monitors to most of these hospitals. First of all, to register, to encounter patients that come for treatment. They must be properly encountered and confirm that they are genuine, they are valid people. Because we got in the past a lot of uncertain number of people that we didn't think were really properly released. So our service quality monitors monitor treatment, monitor prescriptions, monitor dispensing, monitor the quality of care that the people are receiving. And the process also encounter them, take their photographs, record that they were really the people that came to the hospital with care. But we are moving a new step. We realize that we can't have agents that will cover all the hospitals. There are about 600 primary health care, private hospitals, government hospitals, access to finance hospitals. There are quite many, over 500. And we need an average of so many monitors. And so we can't cope alone. We now invite the hospitals, primary health care centers, to ensure that their record officers are trained to carry out their function. Registration of a patient in a hospital is the duty of the record department of any hospital. But we took over that function to make it seamless. At the same time, we will hand-on training of their staff. And so this meeting you saw today is the training of the primary healthcare centers in Delta North. Not only the OIC, the matron that is in charge, but at least 2 more persons. The record officer, the dispenser, or a nurse, the SHU that is working with them. The purpose is first of all to train them on the new policy and how to implement it. And secondly, to train them on how to encounter patients by themselves. And 3, to train them on how to send their bills, prepare the claims, and send it to us electronically, nothing manual anymore. And so the training is multifaceted to ensure that they are well groomed in registering with their patient, encountering the patient for care, ensure that they know how to prepare the bills of the patient, and also to advise them on how to care for the patient. Especially ensure that they receive their complete prescription.
He noted that the healthcare workers were the first contact enrollees had with the system, hence their professionalism, empathy, and integrity remained key. The DG called on the healthcare workers to desist from extorting enrollees and ensure they applied for drugs from the Drug Revolving Fund (DRF) 2 weeks before their drugs are expended to bridge any gap at the point of care. Dr. Akpoveta commended Governor Sheriff Oborowori for his consistent support and commitment in the health sector, which he said had been a major source of motivation to the Commission, reiterating the Commission's commitment to building a robust workforce to drive the policy, particularly at the grassroots.
So the PHCs are very vital to this scheme. Without PHC, you cannot achieve universal health coverage. Universal health coverage have many components, but two key components is financial equity, and then also equity, financial assets, and physical assets. You can have your money, but there's no hospital to go to. It's too far away. You can have access, there's a hospital by your doorstep, or you cannot access it because you don't have money. So these two components are very important, access. And so, luckily for Delta, almost every village has a primary health care center. So we have close to 500 primary health care centers across the state, plus the government hospital and other hospitals. So we have a good spread. But the primary health care centers need to be properly managed. They need personnel, they need resources like drugs, they need equipment. Like I said today, we'll probably find a way to see how we can help them achieve a side lab where they can be doing urine tests or all those minor tests before sending the person to the next bigger hospital. So we want to ensure that the primary health care centers are properly organized. And one of their challenges is drugs. The drug supply system in Delta State is centralized from DRF, and DRF have to supply drugs to every nook and corner of the state. It's not easy. Even if they have the money, the distribution is a challenge. And so some of the hospitals are not getting drugs on time. And two, they don't make requisition for the drug on time too. So we held a meeting at the top level with DRF manager and other stakeholders, and we agreed that all the primary health care centers and hospitals should apply for drug 2 weeks ahead. Look at your stock. As your drug stock is depreciating, you should apply for drug because there's a time lag between request for your drugs and then delivery of the drugs to you.
Participants who spoke at the end of the training, including heads of primary healthcare centers, billing officers, and pharmacists, commended the DG, Dr. Akpoveta, for making the training interactive and gave an assurance that the knowledge gained will be put into good use.
Interactive, and it was clear. I told someone this man was very good lecturer. He lectured. He didn't need any coach. And after this training, I'll be able to effectively do my work without any problems.
The impact will tell me that at least to develop another method, or just a new method of doing your work perfectly without any error. Because the other one was kind of use another system again in order to do your best, give out the best.
For today, we have learned a lot of things, the new innovations and the policy under the contributory health. And the DG has made it so easy that was able to bring out a date of a person and able to show us what they are doing and what they have paid so far. Especially for those of us who are new into the system, at least what they paid was what I got, and that was what was shown to me. I want to say we thank you to Delta State, to the governor for the services so far, to the non-privileged, and also to the commission for their good work. to see that the PHC are also functioning. He has done so much with the PHC in terms of healthcare, making our mothers and the less privileged to come to utilize the health facilities, and even to the workers. The Commission has made us to help us to get some workers because of lack of manpower in the system.
We are trained on how to do our capitation, how to raise claims, and how to enroll our patients using the e-health application and the self-cognition app. Before now, I have no idea of using those apps to enroll our patients. But after today, I think I can enroll our patients perfectly. It's a nice one actually. It's a very good one because the health industry is an industry where you learn and you learn new way of doing things. So from today's training, we learn a lot.
The training continues in other senatorial districts of the state. Eunice Emiozia reporting.